Okay, first what we're going to go into is a talocrural distraction manipulation. Go ahead and lay on down for me. So what you can do for this one is come up right on the talocrural joint. So you're going to distract right in there. And then basically you're going to bring up a little bit and find that point where you feel it kind of gapping a little bit and feel a little bit into the restriction. So once you feel just like perfect, I'm just going to give this a little quick stretch. Going down and just like that. So a little bit. You can also do a subtalar distraction manipulation in this, where you come down, you get the subtalar joint a little bit more uncomfortable. But what I like to do is come in, support the talocrural, come down, and add a little bit of this distraction manip, just like that. Both of those are pretty can work pretty beneficial as well. So let's just kind of go through some mobilizations with this, and we'll turn over and do a few that way. Talocrural joint, often something we want to work. So you can come in here. Generally, I'll always flex the knee just a little bit, because if you don't, you might be getting a little bit more gastro than you want. But just come in to the talocrural joint and make sure you're going kind of perpendicular to that joint line, going back and forth just like this. So a couple ways you can do this is you can come support with your other hand, as long as they have a little small foot. So I've got it blocked here, kind of going down back and forth. Another way, you can put something underneath here, just to block it a little bit as well. So that will get your talocrural APs. If you actually want to do it a little bit different, you can always use the distal tip fib going down a little bit and working more into your distal tip fib. Now, when you're working the distal tip fib, it's always good to remember, of course, our convex concave rules. A lot of times you'll see people actually working the distal tip fib to gain ankle dorsiflexion, and what they'll do is they'll go A to P. So kind of go A to P and then work on that way. The problem is, if you are working the convex concave, the distal tip fib actually needs to go anterior. Oftentimes we think it goes posterior because of our lateral ankle sprains, and this is written up in Mulligan's work, that you might actually have an anterior fault. So it slightly goes a little bit above. So his taping and mobilizations and all that actually has the distal tip fib going posterior for your acute lateral ankle sprains. And I'll just clinically and anecdotally, I'll perfectly agree with that. My main thing when it comes to the ankle is don't get caught up in all of that. Just simply try one thing. Does it reproduce or kind of diminish the pain? And test and retest. Oftentimes I'll find even with zero history of ankle sprains, I need to go posterior with that distal tip fib versus anterior. But I try with everything. The number one way you can quick check this is just a quick mobilization with movement. Kind of go down a little on the distal tip fib, and go ahead and bring your toes towards your nose. Good, and then come on back just like that, and then have them do it, and does that improve or not improve? And then if it doesn't, if it feels painful, switch to the other side. So, of course, we know all of our mobilizations. I can come in and again work mid-tarsals into the mid-tarsal joint, the CMC joints, and all that stuff into this position. So another way that we can do is bring her foot up. We can work on plantar flexion, do that mobilization with movement. Again, distal tip fib. Now we'll go posterior. Go ahead and bring your foot down for me. Good, and bring it back up. Bring your foot down for me. Good, and come back up, just like that. So another way that you can work into it. Go ahead and lay onto your stomach for me. So, some things that we can do is we can come in here, open chain. You can do a gas drop, pin and stretch into this position. That can work really well. Another way that you can do it too is you can do your flexor hallucis and all that. Just coming in here, kind of those deep muscles. And first, go ahead and don't let me straighten your toes out. Ready? Hold, and relax. Okay, try that again. Hold, and relax. So feeling where those are just by that contraction, kind of follow them along, kind of your Tom, Dick, Harry. And that, and then working into those you can do as well. So just having that pin and stretch just like that. You can do a lot of ankle mobilizations in Pro. So one thing you can do again is come into that talocrural, go in A to P. You can go in here, kind of block P to A, depending on what you're trying to gain. Come in here and work the subtalar joint. One really good way to work this is kind of that eversion, that lateral mobilization. So go into it just like that a little bit. Some other things you can do in this position is you can again work just kind of throughout the foot, and you can do a couple of manipulations in this position. So I'm going to show the cuboid whip. This is the way I learned it. Go ahead and scoot out for me a little bit. Scoot down. My bad. And just a little bit more. Good. What I've learned it is foot off the bed like this. I haven't learned it the full leg off. But basically coming into this side, coming and pinning in here, and just coming in. And what you're going to do is you're going to kind of just whip down and almost use the table as the blocking point. So find the cuboid. You'll know it on it. They're like, ooh, that's it. Get that and then whip it down. Whip it down just like that. So that's a really good cuboid whip to work with. Go ahead and lay onto your right side for me. Subtalar joint can be worked a little bit into this position, so I'll actually work on to her both feet just to show, but you can work down onto this. So say we're having a hard time, that ankle is constantly kind of varus there where the heel's going in. You can come in and work. This is really good for our plantar fascia group. Really, really good to work into. Actually, with Mulligan's work as well, he suggests doing, he calls it subtalar external rotation, but working on this for most of your patients that have that. And actually something they follow up really well with this is actually a taping, where you go on to the inside of the thing and inside of the medial heel, wrap it around the ankle, working it just like that. Just kind of lightly going into it, working that. Or say we need to work it the other way. You can easily come in, have it. I like to just brace wrist, but you can always get the pillow or just off the bed and then working it right there. For her, definitely doesn't need to do that because it's a little bit mobile on that side. Alright, so finally let's go into a little bit of mobilizations with movements. So go ahead, if you're comfortable, kneel on the bed for me. And then like a lunge position. So, a couple of different ways you can do this. Show both ways. So, I cannot use the belt and just kind of block here. Go ahead and lunge forward for me. Kind of going down just like that and come back up. Perfect. I can use just my hand blocking, or I can use the belt just to give a little bit of overpressure, just like that. Again, with Mulligan, if you can overpressure into the resistance and be pain-free, you're always going to be better off that way. Another way you can do this, so that's our mobilization with movements, really good. Another thing you can do is coming in here, go ahead and lunge towards me, doing a little bit of internal rotation of the tibia and coming on back out, just like this. And oftentimes, I'll give this as homework. They can always come down in here and grasp down here. They can always come in and do that internal rotation, but both of those to work with the knee and ankle pain if they're having issues with inadequate dorsiflexion. The other way that I also do this as well is say the ankle just has some quadrant issues, especially they notice when they are doing a lot of their athletic things like CrossFit, stuff like that. Something a lot of times I'll teach, and this is just kind of a reset. Mobilization, it kind of works, but it's just not getting there. Oftentimes I'll teach them, I'll work on them this way, but I'll also teach them is come down, kind of blocking the ankle at that talocrural joint, and just maybe doing some lateral ankle glides just like this. And what that helps is just kind of clear up this little quadrant a little bit, just like this, and have them wiggle it. So what I can do is always hold and go bring your knee out to my hand. Perfect. Come back in. just like them, have them do it themselves, or I can do it passively. And what you'll notice, that'll clear up a lot of this kind of junk in the paint right there. Go ahead, Alex.